Total hip replacement is a gold standard procedure for hip arthritis condition, and it is one of the most successful operations in the history of surgery in terms of improving the quality of life of the patients. Hi, I'm Mr. Umar. I'm a trauma and orthopedic surgeon specializing in lower limb arthroplasty. Today we are going to talk about hip arthritis. Hip arthritis is a condition when lining of the joint of hip joint is affected either with the wear and tear of everyday life or because of some other conditions like trauma or inflammatory conditions. Essentially, hip joint actually is a joint actually which communicates between the pelvis and the lower limb. And any condition affecting this joint significantly compromises somebody's ability to walk, ability to mobilize, ability to carry on with their everyday function. Quite commonly, patients can present in the form of pain, typically pain in the groin, and also sometimes pain can affect areas around the hip joint as well, like on the side of the hip, on the back of the hip, and occasionally people present with lower back pain as a result of hip arthritis. People actually find difficulty with dealing with the activities of daily life, like they find difficulty reaching down to their feet, like cutting their toenails, or putting up their socks, or actually simply just walking on flat sometimes can be difficult as well in kind of advanced conditions of hip arthritis. Initially, actually, this condition starts affecting their activities, but with time, if the disease progresses further, it can start actually affecting their rest as well. They can have difficulty in the bed, they cannot sleep comfortably, they cannot sit comfortably, and cannot carry on with their everyday function. So, typically when a patient comes in with hip arthritis, we have to do some clinical examination, which will confirm the findings of the hip arthritis. And further on, actually, we can get help from further investigations, like starting with the plain x-rays. But sometimes we have to do some more investigations as well, like performing special scans of the hip, and also maybe some diagnostic injection into the hip joint as well. Once the diagnosis is confirmed, there are different ways how we can manage this condition. Although it's a very debilitating condition, quite typically affects later aspect of our life, but we have the different management options available to help dealing with this problem. Main principles of management of hip arthritis would be taking away the pain, improving the flexibility, and allowing the person to get on with their everyday life, essentially improving their quality of life. So treatment options, we start actually from non-operative and then actually progress to operative if required. Non-operative management options include modification of lifestyle activities, like avoiding the activities which particularly are giving you the pain, trying to keep our body weight in control, which significantly reduces the stress on the joint, and in return, it improves the pain and quality of life. Using walking aids, like walking a stick, particularly in the hip arthritis situation, use of a walking aid in the opposite hand. Other measures include doing a bit of physiotherapy rehabilitation to build up the strength of the muscles around, taking away the pressure from the joints. And moving forward toward medical side, we can start using simple analgesics, use of anti-inflammatories can help. And moving forward, sometimes anti-inflammatory drugs like corticosteroids can be injected into the joint to calm down the pain symptoms. These injections do not cure the condition, but they can help improve the quality of life by taking away the pain because of this condition. If arthritis progresses further and is not been controlled with the non-operative measures, we have to consider the option of surgeries. Total hip replacement is a gold standard procedure for hip arthritis condition, and it is one of the most successful operations in the history of surgery in terms of improving the quality of life of the patients. It's a major surgery, does have its own certain risks of complications, but following surgery, 95% people will have notice significant improvement of quality of life in terms of their improvement of pain and their flexibility and their ability to do activities what they want to do in their life. Usually hospital stay for this operation is 1 or 2 nights, And it's a full package of physiotherapy rehabilitation, which starts actually before surgery and carries on after surgery as well. And by 6 weeks mark, we do expect patients to start walking independently with a very limited amount of discomfort once actually surgical pain settles down. So essentially, hip arthritis can be a very debilitating condition. It can significantly affect one's quality of life, but good thing is we do have options available to help dealing with this debilitating condition and improving your quality of life. If yourself or one of your loved ones have got this condition, they can actually contact your healthcare professionals and they can guide you further towards management of this condition and improving your quality of life. Thank you.